The Kenya Malaria Indicator Survey 2020 reveals that the country has come a long way in eradicating the disease, boosting the Ministry of Health's optimism in fully eradicating malaria by 2030.
It all depends on the efforts from the different quarters, but in terms of it being achievable, it is.
So in the urban areas, the malaria prevalence was 3%, and in the rural areas, it was at 7%, which is slightly double.
However, it has emerged that there is only 49% of insecticide-treated nets coverage in Kenya, down from 63% in 2015. The highest coverage is 78% at the lake endemic region.
There was an improvement in the uptake of Fancida to prevent malaria in pregnancy. At least one dose, it rose from 77% in 2015 to 80%. At least two doses, it rose from 56% in 2015 to 65% in 2020. And the third dose rose from 38% to 48%, which is quite encouraging because these are the mothers who are at most risk of getting malaria.
In 2016, malaria caused an estimated 3.5 million infections and just over 10,000 deaths in the country. Currently, there are still 5 malaria endemic zones in Kenya, with the lake region having the highest burden at 19%.
Meaning 1 in every 5 people living in the what we call the lake endemic region had malaria at the time of the survey. However, this is an progress from 2015, where it was at 27%.
African Leaders Malaria Alliance Senior Advisor Dr. Willy Sakwale says 4 agendas have been developed to hasten malaria eradication in accordance to President Uhuru Kenyatta's legacy.
We are working, the End Malaria Council is actually bringing a lot of private sector players on board to look at how we really must start manufacturing the bed nets, the malaria medicines, insecticides and repellents and larvicide in this country.
The most important of the 4 is the youth's agenda to bridge the high unemployment gap. Ben Kirera, K24, Nairobi.